Are you tired of watching politicians scream at each other about healthcare while nothing ever gets solved? On one side, you hear Medicare for all. On the other, don't touch my insurance. And in the middle, millions of Americans, hardworking, stressed, and ignored. That's why we're here. This is the stressed Sideliners party. We are the people in the middle who've had enough of the noise. Our symbol is the owl, calm, steady, and wise. While the elephant charges and the donkey kicks, the owl sees through the dark. And our slogan says it all. Wisdom over noise. Neither left nor right, forward. Nowhere is that wisdom more needed than in healthcare. Here's the truth. America spends more per person on healthcare than any country in the world. Yet our results rank lower. Families go bankrupt from a single hospital bill. People skip their medicine because they can't afford it. Emergency rooms are clogged with problems that could have been treated early, and the only thing the two parties do is fight about ideology while real people suffer. So what's the SSP's answer? We believe in universal access to healthcare. That means every American gets care. Nobody is left out. Nobody goes bankrupt. But, and this is important, universal access does not mean government controls everything, and it does not mean leaving people to fend for themselves in a broken system. It means universal access with freedom of choice. Here's how we do it. First, we cut the waste. Our system bleeds hundreds of billions of dollars every year on bureaucracy, duplicate billing, and paperwork that nobody understands. We will streamline the system, simplify forms, and end the games that let middlemen profit off confusion. That money should go to patients, not red tape. Second, transparency. Right now, no one knows the real price of anything until the bill shows up. That's insane. Hospitals, insurers, and drug companies will be required to post real, upfront prices. When costs are visible, competition works and prices come down. Third, prescription drugs. Did you know the exact same pill can cost 5 or 10 times more here than it does overseas? Why? Because other nations negotiate fair prices and we don't. That ends with the SSP, Medicare, and a new public option we'll create. We'll negotiate drug prices directly, saving Americans over $100 billion a year. Fourth, shared responsibility. Under our model, individuals and employers will still contribute to healthcare, but those costs will be capped, stable, and predictable. No more endless premium hikes that crush families. The government will provide a basic safety net, funded not by massive new taxes on the middle class, but by trimming waste, fixing drug pricing, and modestly asking those at the very top to pay their fair share. Fifth, prevention comes first. It is far cheaper, fun, and far more humane to catch illness early than to treat it late. We will expand community clinics, support local healthcare programs, and make sure rural and underserved areas are not forgotten. We'll strengthen mental health services and addiction treatment, because these are healthcare issues, not afterthoughts. And we'll invest in preventative care, screenings, checkups, and wellness programs that save lives and money. Sixth, innovation and efficiency. Healthcare should move forward, not stay stuck. We'll expand telehealth so people in rural towns can see specialists without driving hours. We'll support technology that streamlines treatment. We'll encourage medical innovation while cutting the waste that makes costs explode. Seventh, competition. This is the balance the SSP offers. We create a basic public option that competes side by side with private insurance. If you like your private plan, keep it. If you want the public plan, choose it. Both systems are forced to work harder and be more efficient because they're competing for your business. That's how we guarantee universal access without crushing choice. And finally, respect for individual choice. Healthcare is deeply personal. No one should be forced into a single system that doesn't work for them. Our approach guarantees a safety net for everyone, while protecting the freedom to choose doctors, treatments, and plans. Nobody gets left behind, but everybody keeps their freedom. Now, some people will ask, isn't universal healthcare a left-wing idea? And here's my answer. No, it's a common sense idea. The left is right that nobody should go without care. The right is right that people should have freedom and choice. The SSP brings those two truths together. Universal access doesn't belong to the left or the right. It belongs to all of us. So here's our vision in one sentence. Every American gets healthcare. Nobody goes bankrupt. Costs are contained through transparency, competition, and innovation. And freedom of choice is protected at every step. This is what makes us different. We don't shout for extremes. We don't play the partisan game. We solve problems. We cut waste. We demand fairness. And we move forward. So if you're tired of the noise, if you're ready for healthcare that actually works, then you're already one of us. We are the stressed Sideliners party. Wisdom over noise. Neither left nor right. Forward. Subscribe, share this video, and let's move America forward together.